Health Insurance Open Enrollment Get Answers is a production of UNC-TV in association with the North Carolina Hospital Association.
How do you find a health insurance plan that fits your budget and meets your needs? A good plan protects you and your family at a price that's right for you. You can feel safe knowing that all marketplace plans cover a core set of essential health benefits, like checkups, having a baby, emergency care, prescription drugs, and more. Most marketplace plans must also include free preventive care, like shots and screening tests. And don't worry if you have a pre-existing condition. You'll see the same plans at the same cost as everyone else. You can't be denied coverage. Here are a few things to think about before you look at health insurance plans. Health insurance is a contract between you and your insurance company. You buy a plan, and the company agrees to pay part of your medical costs when you get sick or hurt. Although all plans in the marketplace cover a core set of benefits, the amount you'll pay will be different from plan to plan. In general, if your monthly premium payments are low, the cost of getting care, or how much you'll pay out of your own pocket for things like prescriptions or hospital stays, will be higher. And if you pay more each month for your premium, those other costs will be lower. Finding a good health plan means balancing how much you pay each month with how much health care you think you and your family are going to need during the year. If you're healthy and don't go to the doctor very often, then a plan with a low monthly premium will probably cost you the least. But if you need to go to the doctor a lot or you need a lot of expensive prescriptions, you should look at plans where the cost of getting care, or how much you'll pay out of your own pocket, will be lower. If you really need a lot of health care, spending a bit more on your monthly premiums will actually save you money in the long run.
We've been hearing about it for the last few years. So what is the Affordable Care Act, and how is the program set up for people who need insurance coverage? Sorian?
Well, the Affordable Care Act actually implemented many reforms that have been going into place since 2010. But specifically, I think what you're referring to is the health insurance marketplace. And every year there is a period where everyone can go and check. It's called the open enrollment period. This year, the open enrollment period begins on November 1st. And will end on January 31st of 2017. So people will have that 3-month window to apply for health insurance on the marketplace. And in the case of the Affordable Care Act marketplace, people are purchasing health insurance individually for themselves or their family members. And there's a great deal of help available to them so they can understand it better. So we've mentioned many terms here: networks and premiums and deductibles and out-of-pocket costs. And so I very much encourage, this can be confusing to people. So I encourage everyone who thinks they may need insurance and want to explore whether they qualify for it to go to healthcare.gov directly themselves and look, but also to call and find an in-person assister in their community. And we're very lucky in North Carolina because you can call one phone number to find an assister for you in any county of the state. And so that number is toll-free, 855-733-3711. Or you can go to our website, which is getcoveredamerica.org, and you just click on Find Local Help, and appointments will pop up right there, and you can schedule yourself into one. And the assisters will sit down with you for an hour or 2 hours and walk you through the process. Mary mentioned you're doing two things at healthcare.gov. You're shopping for insurance and looking at what plans are available to you. And the second thing you're doing is you are putting in your personal family information and applying to see if you qualify for financial help to pay for your plan. And 90% of the people, or actually 92% of the people in North Carolina who are enrolled in marketplace plans now are getting financial help to pay for them.
The world of health insurance can be confusing, but we're here to help with information on how to sign up for the health insurance marketplace. To get us started, here are some general tips about the marketplace. The marketplace is for people without health coverage. This means that you don't have any coverage through your job, Medicare, Medicaid, the Children's Health Insurance Program, or any other source that could provide you with coverage that the government deems to be acceptable. What you pay for insurance with the marketplace depends on your income, and you will most likely save with a new marketplace plan compared to what you are spending now. You can apply for coverage in 4 different ways: online, on the phone, mailing in an application, or in person with a local assister. And finally, if you don't have any health insurance, you may have to pay a fee, so make sure to check out healthcare.gov for all of your options. Make sure to take note of important dates and deadlines before you apply. Open enrollment begins on November 1st, 2016, and continues until January 31st, 2017. However, if you wish for your coverage to begin on January 1st, you'll need to enroll by December 15th, 2016. If you miss the January 31st deadline, it isn't necessarily too late to get coverage with the marketplace. You may qualify for a special enrollment period. Go to healthcare.gov for more information. In order to better prepare for your application, try to gather as much relevant information as possible from the checklist that healthcare.gov provides. Some of the details include information about your household size and how many people you want to put on your plan, all of the applicable Social Security numbers for those people, gather any document information on legal immigrants in your household, take note of how you file your taxes, plus many other details. Be sure to look at the full checklist on healthcare.gov. Now, most importantly, there are 4 different ways for you to apply for marketplace coverage. You can apply online at healthcare.gov. You can start your application as soon as enrollment opens on November 1st, 2016. You can apply on the phone. The Marketplace call center is open 24 hours a day, 7 days a week, and their number is 1-800-318-2596. If you wish to fill out an application in person, go to healthcare.gov and enter your zip code to find a certified assister who works near you and can help you through the process. And lastly, you can mail in your application. The paper application can be printed off of healthcare.gov, and your eligibility results will be sent to you approximately 2 weeks after you send your application in. It's a complicated process, but there are lots of resources that can help you get covered. Go to healthcare.gov or call 1-800-318-2596 with any questions.
Now, what are the situations where people can find out if they can get assistance?
Well, anybody who is uninsured or has family members who are uninsured should make an appointment with an assister and find out what they might qualify for. There are certain people who the law had intended to be covered by Medicaid who may have such a low income that the system is not set up to be able to pay enough to help them so they could afford it, and they may be exempt from getting insurance. But anybody who could qualify for health insurance and financial help on the marketplace or has a higher income and could pay for it themselves is required to have health insurance and could potentially be fined if they qualified for help and didn't take it and remained uninsured for the year.
So, Sorian, you were saying that people who have low incomes may not be eligible for subsidies. What did you mean by that?
The Affordable Care Act gave states the option to expand Medicaid to cover adults with incomes under the poverty level. And North Carolina chose not to expand Medicaid. So people with very low income, like I said, less than poverty level, may not qualify for enough subsidy to purchase a plan on the marketplace and may not qualify for any Medicaid coverage either. And so those are mostly adults. And they would not be subject to a fine then. But everyone who's not sure if they have enough income should go see an assister at our North Carolina call center. They can make the appointment, like we said, and should make that appointment to make sure about what they qualify for. Even if they as an adult don't qualify for Medicaid, their children very well might, because children qualify for more assistance at higher income levels than adults do.
And remind us the deadline processes for the Affordable Care Act.
Yes, everyone can check to see if they are eligible for financial help in a health insurance policy on the marketplace starting November 1st, and they have until January 31st to enroll. So that 3-month period is called open enrollment. For people who are renewing their plan that they have this year or re-enrolling in a new plan, they really should do that before December 15th so that they can have no gap in coverage and they can start their plan starting January 1st, and so that they get the right financial package to pay for it.
So now we're going to take a quick look at the levels of plans that are available on the marketplace.
It's time for you to pick a health insurance plan with the marketplace, but how do you know which one to pick? Here are some things to think about before choosing. There are 4 metal categories to pick from: bronze, silver, gold, and platinum. These categories demonstrate how you and the plan share costs. This does not reflect the quality of provider care. You should figure out your total current costs for health care before choosing. You currently pay a monthly bill as well as personal costs when at the doctor. You should make sure to understand how much you pay now before selecting a plan. And you should also try to understand plan and network types: HMO, PPO, POS, EPO. Know that some plans allow you to use almost any doctor, while some will limit your provider choices. Let's explore the metal categories. You pick whichever plan you want based on the shared costs, not based on the quality of care. Pick the one that is right for you and your financial situation. The bronze category has the lowest monthly premium, but has the highest costs when you need care. This is the best choice for you if you want a low-cost way to protect yourself from major medical scenarios, but you will need to pay for most routine care out of pocket. The silver category has a moderately priced monthly premium and moderate costs when you need care. This is the best choice for you if you are willing to pay a slightly higher monthly premium than bronze to have more of your routine care covered. The gold category has a high monthly premium but low costs when you need care. This is the best choice for you if you are willing to pay more per month in order to have fewer costs when you need medical treatment. And the platinum category has the highest monthly premiums of the 4 types, but it also has the lowest costs when you get care. This is the best choice for you if you use a lot of care and are willing to pay a high monthly premium while knowing that nearly all other costs will be covered.
It's not just individuals who are looking at policies in the Affordable Care Act marketplace. Small businesses are also able to sign their employees for coverage. So, Sorian, what are some of the things that small businesses need to know about in signing up for the Affordable Care Act?
I think the way the small business market, the shop market has worked has not led to a lot of small businesses going there. Many of them are still purchasing plans off the marketplace. The marketplace is intended to help people that are 50 or fewer, not for companies that are bigger than 50 employees. And again, just like with individuals, I encourage them to go to an agent or broker to see if they can get help understanding what all their full options are on and off the marketplace.
Health Insurance Open Enrollment Get Answers is a production of UNC-TV in association with the North Carolina Hospital Association.